It's very nice to see you. My name is Leanna and I'm the PA that will be taking care of you today. It looks like for the appointment you put that you were having some pelvic pain. Okay. And do you mind pointing to where the pain is? Gotcha, okay. And I'm sorry, how long has that pain been going on for? Okay. Alright, gotcha. And when you get this pain, is it more of like a dull, achy pain? Is it more like very sharp, kind of knife-like pain? Okay, can kind of vary. Okay, and no trauma to the area recently? Right. Do you find that the pain is at random times? Do you find that it's after you eat meals or during a certain part of your cycle? Okay. And if you were to rate your pain on a scale of 1 to 10, 10 being the worst pain? Okay. Do you know when your last annual PAP was? Okay, pretty recently. Gotcha. And are you having any other symptoms? We'll start with urinary symptoms, burning when you pee, peeing too much. Okay, what about accompanying vaginal symptoms, whether it's abnormal discharge, burning, pain during sex? Okay. And have you noticed any change in bowel movements at all? Yes, whether that be diarrhea or constipation. Okay. Okay. Got you. Any other symptoms you've noticed throughout your body? Fever, chills, swelling? No significant weight loss, right? Okay. Any pertinent past medical history that I should be aware of? You've had ovarian cysts in the past? Okay. Any surgeries? No. Alcohol use? And then any recreational drug use or smoking? And how often? All right. Family history of breast, ovarian, or uterine cancer? Okay. And any new sexual partners recently? Okay. All right. Are you on any forms of birth control? Gotcha. Okay, well, I am just going to start by doing some vital signs if that is okay with you. You reported no fever, chills, correct? And you don't live with anyone who is sick or has COVID? All right. Do you know roughly how tall you are? Okay. All right, let's get started here. Just simple vital signs, and then I'll kind of explain what we'll plan to do as far as the examination goes. All right, just gonna grab a few things here. Gonna get an alcohol wrap. Just wipe down. Stethoscope. Do you have a preferred arm for the blood pressure? I'll use this one. Absolutely. this around your arm. Gonna get a little bit closer here. Let me know if it's too tight. Alright, I'm gonna go silent for a little bit. Blood pressure is good. Right. Let me back this up here. Next up will be a quick temperature check. And this is just going to go under the tongue, okay? No, yeah, I'm definitely glad you came in, seriously. I'm here for you anytime you need, but you know that. Alright, this is just going to go underneath the tongue. If you could close, please. Thank you. Perfect. Temperature is good. Put the cover on here, back on. So for a thorough assessment, what I would like to do ideally is a pelvic exam, if that is okay with you. That's when we look on the outside of the vulva area, and then we use a speculum to look inside, make sure I don't see any obvious signs of infections. We'll do an internal exam with my glove to make sure I don't feel masses on either side that an ovary would be, and that there's no enlargements that I note, as well as tenderness. Does that sound okay? Awesome. And if that exam is unremarkable, then we'll definitely want to go ahead with an ultrasound. I usually tell people when we do internal pelvic exams, of course, we're able to see the vagina and the cervix, but we're not able to actually see the uterus and the ovaries. So the imaging will definitely help with that. So we'll probably plan on putting in orders there. Yes, and yes, I do have Sally the speculum to squeeze onto. No problem at all. All right, let me take this off here. I'm just going to set up the station. So we will be using a small speculum, of course, as you know. We'll be using some lubricant today. We are going to be doing an infection screening swab. And do you by any chance know if you'll be able to leave a urine sample for me today? Awesome. Yes, I just want to rule out, of course, a urinary tract infection. All right, let me hand you Sally. There you go. And then it looks like you're kind of already in position. I'm just going to get some gloves on. Just gonna kind of keep you covered there. Do you feel comfortable? As comfortable as you can feel, I should say. Good, good, good. So I am actually going to start before we, do the pelvic down here. I'm just going to press on your abdomen area here, do a bit of percussions if that's okay. Awesome, awesome. So you're going to feel my hands here at the side of you. Over here is where it's a bit tender, okay? I'm going to do some percussions. Okay, very good. I'm sorry if this is super uncomfortable. I apologize. Let me get you covered back up there. All right. Let me just turn on the light. Alrighty. Now, we are going to start just by looking on the outside only right now, okay? And I will walk you through the whole thing. No surprises, as you know. I'm going to feel my hands down here, just looking on the outside. And you're not feeling any new bumps down here, right? Good, good, good. Just want to make sure. Okay. So far, the external exam is looking normal. All right. The next part of the examination is with the speculum. I'll be sure to put some lubricant on there, okay? Absolutely, yes. All right. You're going to feel my hands down here again. Yep, this is the speculum part. You're going to feel my hands down here. You okay to proceed? All right. You're going to feel kind of that pressure that you normally feel. Yep. Sorry if it's a little bit uncomfortable. All right. Don't see any cervical masses or anything like that. All right. We are going to get started with our infection screening swab. You're going to feel that swab sample. All right. Put it in the specimen container, swirl it around. All right, I am going to release that speculum now. I'm going to take that out for you. Okay, it is out. Last part of the examination is with my glove. I'm going to put some lubricant again. All right, and you're going to feel internal pressure from the glove. Any pain when I poke back here? Okay. All right, glove is coming in. All right, so let me cover you up back here again. Just gonna get some hand sanitizer here. So, as far as the examination went, everything overall looked very healthy. You had very minimal, like a yellowish thin discharge, so I'm screening that for infection. We are definitely going to go ahead with the ultrasound, okay? I wasn't able to feel any obvious enlargements or masses, but of course, you can just never be too sure. You need that imaging to confirm. So I am going to write you a script here for ultrasound of the ovaries and uterus. Now, just so you know, this is a transvaginal ultrasound, as this is the best way that they're going to be able to see both of those things. That's okay with you? Okay. All right. All right. I'm going to fold that up here. So that is going to be for you. You'll take that to the front desk as well so they can get that scanned in your chart. Okay. Other than that, I just wanted to hand you a cup. I just need you to leave me as much urine as you can before you go. We're just going to screen for urinary tract infection as well, okay? Yes, yep. So I will leave that with you as well. And you're all set for today's examination. Hopefully after the ultrasound comes back and the lab work, we'll definitely have a lot more answers regarding your pain. Yep, absolutely. Do you need me to send you a prescription for the pain that you're having? Yes, yep. I can definitely send that electronically for you, okay? Oh yeah, no, it's my pleasure. My pleasure. All right. With that being said, if you have any questions or any concerns, you please call me. Otherwise, you are all set. I'll leave you to get dressed, and then the girls at the front desk will see you for checkout and get everything taken care of for you. And once you get your imaging, I'm going to give you a call and we could review it. You know, with your history of ovarian cysts, it may be possible that perhaps one of them ruptured, or that maybe you have another one that's of a significant size. So like I said, that ultrasound will be very telling. Yes, exactly. But like I said, I'm going to go give you some privacy now. I am done talking, but we will talk soon. For sure. All right. Well, I hope you enjoy the rest of your day. See ya.